Hello and welcome back to Senior Mental Health. I'm Dr. James. And if you're over 60, or care for someone who is, today's video might just change how you think about your body forever. Let me ask you something. When was the last time you really paid attention to your belly button? Sounds silly, right? But here's the surprising truth. What you don't see, don't feel, and don't clean, might be silently working against you. I've been in the medical field for over 3 decades. And I've treated everything from chronic disease to subtle skin infections that started in the most unexpected places. One of those places? Your navel. As we age, the simplest routines, like daily hygiene, require a new level of awareness. Because what worked at 30 might no longer protect you at 70. And when it comes to the belly button, ignoring it could mean infections, inflammation, and even more serious complications for your immune system. In today's video, we're diving deep, literally and figuratively, into a part of your body that you likely overlook every single day. You'll hear real-life stories, expert advice, and practical steps that take just 3 minutes a day but can save you weeks of discomfort or even a hospital stay. And trust me, by the end of this video, you'll never think of your belly button the same way again. So grab a cup of tea, settle in, and let's get started. As we grow older, the aging process introduces numerous subtle yet significant changes in how our body functions. Especially in our extremities, the feet, often taken for granted, are among the first body parts to show signs of systemic decline. This is due to a variety of interconnected factors: reduced circulation, thinning skin, decreased fat padding, and weakened immune defense. In clinical practice, I often see elderly patients walk into the consultation room with minor foot problems that have quietly progressed into major mobility concerns. These are not just cosmetic issues. For seniors, foot neglect can mean the difference between independence and immobility. One of the most medically critical changes associated with aging is peripheral vascular resistance. As arteries harden and blood flow decreases, especially in the lower limbs, the body's ability to heal even the smallest wound is impaired. What begins as a minor abrasion or unnoticed blister can rapidly evolve into a chronic ulcer or, worse, a source of systemic infection. For diabetics, this risk is amplified tenfold. In addition, skin loses its elasticity and moisture as we age. The result? The soles and heels, which once flexed effortlessly, now crack under pressure. These cracks, called fissures, might seem insignificant, but to a physician's eye, they are potential entry points for harmful pathogens. Left untreated, these fissures can bleed, become inflamed, or act as the portal for deep fungal or bacterial invasions. Fungal infections are notoriously common in this demographic. I've treated countless cases of tinea pedis, commonly known as athlete's foot, in patients who were not athletes at all. Elderly patients, particularly those with limited mobility, tend to bathe less frequently or inadequately dry between their toes, inadvertently creating the perfect storm of warmth, darkness, and moisture that fungi thrive in. What often begins as simple itching and scaling may soon escalate to painful fissures, blistering, and cellulitis. Let me tell you about George, a 75-year-old retired woodworking teacher. He'd spent most of his life on his feet, building, teaching, demonstrating the art of precision. When George came in for a routine blood pressure check, I noticed him limping slightly. Upon examination, we found a deep, inflamed ulcer on his right heel. George had thought it was a small crack from dry skin. Within a few weeks, that crack had turned into a gaping wound. Further tests revealed that George, like many men his age, had undiagnosed type 2 diabetes. The poor circulation had slowed healing, and the unnoticed fissure had become infected with both bacterial and fungal agents. We initiated systemic antibiotics and referred him to a podiatrist for wound debridement. Thankfully, with custom orthotic pressure relieving insoles and daily dressing changes, George avoided amputation, but only barely. It was a sobering experience for him. Contrast that with Eleanor, an 82-year-old woman who had lived alone since her husband passed 5 years ago. Eleanor prided herself on staying independent, but because she had arthritis in both hips, she had difficulty bending down to inspect her feet. Over time, she developed thick yellow toenails and a persistent burning sensation between her 4th and 5th toes. Eleanor dismissed it as old people's problems until one day she slipped in the kitchen due to her unstable footing and ended up with a fractured wrist. During her hospital stay, we diagnosed a severe fungal infection coupled with peripheral neuropathy, loss of sensation in her feet likely related to chronic hypertension and age-related nerve degeneration. These stories are not isolated. They echo throughout geriatric care units across the world. Most of these cases could be prevented with a simple daily routine. Let's explore what I tell every patient over the age of 70 who comes into my office. A daily foot care protocol designed not just for cleanliness, but for disease prevention and life quality preservation. Start with daily inspection. Use a mirror or ask a family member to help. Check for discoloration, swelling, bruises, cuts, or signs of infection. Pay special attention to the spaces between the toes, where infections love to hide. Then, washing. Lukewarm water is key. Hot water can scald aging skin. Use a mild, non-scented, pH-balanced soap. Avoid antibacterial soaps unless prescribed. They can disrupt the natural skin flora. Wash gently using your hands or a soft cloth, paying close attention to the soles, heel, and between the toes. Drying is as important as washing. Pat the feet dry with a clean towel, never rub. Use a separate towel for your feet if possible. Make sure to dry between each toe. Residual moisture here can act as a haven for fungus. Next comes moisturizing, but with caution. Apply a fragrance-free, non-greasy lotion to the tops and bottoms of your feet, avoiding the toe spaces. Ingredients like urea, lactic acid, or glycerin are particularly effective for aging skin. These keep the skin supple and prevent painful fissures. Nail care is another area where older adults struggle. Nails should be trimmed straight across to prevent ingrown toenails, which can easily become infected. If your vision or mobility is compromised, see a podiatrist regularly. This is not vanity. It's preventive medicine. Socks and shoes matter more than most people think. Choose moisture-wicking socks made of cotton or bamboo and change them daily. Avoid synthetic materials that trap sweat. Shoes should offer good arch support, a wide toe box, and breathable material. I often tell patients, if your shoes are stylish but cause even slight discomfort, ditch them. Comfort is king after 70. Avoid walking barefoot, even at home. One minor step on a sharp object or even a loose tile can cause a wound that spirals into months of treatment. If you must walk barefoot, inspect the floor carefully or invest in non-slip, cushioned slippers. Now, let me summarize everything in a checklist. Daily Senior Foot Health Checklist. Inspect feet in good lighting, use mirror if needed. Gently wash feet with warm water and mild soap. Dry thoroughly, especially between toes. Apply fragrance-free moisturizer, avoid toe spaces. Wear clean, breathable socks. Wear supportive, properly fitted shoes. Trim toenails straight across, or see podiatrist. Avoid walking barefoot. Report any changes, color, swelling, wounds, to your doctor. And now for my doctor's pro tips, collected from decades of experience. 1. Use a long-handled foot brush or sponge if mobility is an issue. Don't avoid cleaning because of flexibility problems, adapt. 2. Check shoes for debris or foreign objects before wearing. This small step has saved many from accidental punctures or abrasions. 3. Monitor skin temperature. Warm spots may indicate inflammation or infection. Cold areas may signal poor circulation. 4. If you have diabetes, see a podiatrist every 2 to 3 months, even if you feel fine. Preventive foot care saves lives and limbs. 5. Hydration matters. Dehydrated skin cracks more easily. Drink water regularly to support skin elasticity. 6. Watch for foot swelling. It may be a sign of heart failure, kidney issues, or venous insufficiency. 7. Smell your socks after wear. It may sound odd, but sudden foul odor could signal infection, even if no visible symptoms appear. Foot care, in the senior years, is not about vanity or indulgence. It's about autonomy, dignity, and preventive medicine. The 10 minutes you invest each day might be the very thing that allows you to walk unassisted. Avoid hospital stays, and continue enjoying the little freedoms, walking in the garden, shopping alone, or dancing at your granddaughter's wedding. Because once the feet falter, so does everything else. As the human body ages, It begins to demonstrate certain vulnerabilities that younger individuals rarely think twice about. One of the most sensitive and often neglected areas is the groin. The groin area is uniquely prone to hygiene-related complications due to a perfect combination of anatomical structure, environmental conditions, and physiological changes brought about by aging. This region includes the inner thighs, the folds between the legs and genitalia, and the perineal area. It contains sweat glands, sebaceous glands, and skin-on-skin contact zones, all of which contribute to an environment that is naturally warm, moist, and prone to friction. In younger bodies, the skin barrier function and immune response are typically robust enough to handle occasional lapses in hygiene. But with aging, this balance shifts dramatically. Skin loses its elasticity and thickness with age, becoming more fragile, less hydrated, and more susceptible to breakdown. The sebaceous glands reduce their oil production, leading to drier, more easily irritated skin. Simultaneously, the groin area continues to trap moisture due to perspiration, incontinence, and even poor ventilation from synthetic clothing or adult protective wear. One of the most significant challenges in this region is the increase in skin folds. As body composition changes and muscle tone decreases, even those who were once quite lean may develop excess skin or lax tissue around the thighs and lower abdomen. These folds create tight crevices where moisture accumulates and oxygen exchange is limited. The resulting environment is ideal for the overgrowth of bacteria and fungi. A common condition seen in geriatric medicine is intertrigo. This is an inflammatory condition that occurs in the folds of the skin when friction, heat, and trapped moisture cause irritation. Intertrigo may start as redness or itching, but without intervention, it can quickly evolve into weeping lesions, painful cracking, or secondary infections caused by Candida albicans or various bacterial strains. Fungal infections are also particularly common. Tinea cruris, or jock itch, presents as a red, itchy, and sometimes scaly rash in the inner thighs and groin folds. Candida, a yeast that lives on the skin naturally, can overgrow and become pathogenic in the warm, moist environment of the groin, especially in those with compromised immune systems or diabetes. Another complicating factor is urinary incontinence. Even in its mildest form, leakage introduces additional moisture to the area. Many seniors wear protective pads, briefs, or adult diapers. While these products are essential for comfort and dignity, they can also trap urine and heat, weakening the skin's natural barrier and accelerating the breakdown of tissues if hygiene is not rigorously maintained. Reduced flexibility and mobility often mean seniors have difficulty adequately cleaning and drying the groin. Arthritis, spinal problems, or balance issues may prevent a thorough wash. Some may feel embarrassed to ask for assistance or may not realize how inadequate their personal hygiene practices have become over time. Let me illustrate this with a real story from my practice. Margaret, an 82-year-old widow, was fiercely independent. She lived alone and was cognitively intact but had mild osteoarthritis in both knees. She reported an occasional odor that she tried to manage with baby powder and frequent changes of underwear. Over the course of several weeks, she developed intense itching and discomfort in the groin but remained silent out of embarrassment. When Margaret finally visited the clinic, examination revealed that she had developed candidal intertrigo, with raw, red, and broken skin in the inner thigh folds. The persistent moisture, coupled with insufficient drying and the use of talc-based powder, had exacerbated the yeast growth. Treatment included a gentle cleaning regimen, topical antifungal cream, and a zinc oxide barrier. She also received education on how to care for the area using a hand mirror and a hair dryer on cool mode to help with drying. What's worth noting in Margaret's case is not just the physical toll of neglect but the emotional weight she carried. She confessed, "I didn't want anyone to think I wasn't clean, but I just couldn't reach the way I used to." Her embarrassment had prevented her from seeking help sooner. Once treated, she not only felt physical relief but an emotional lightness, free from the persistent discomfort and the anxiety that came with it. In another case, Thomas, a 79-year-old retired engineer, came in complaining of chronic fatigue and loss of appetite. Upon closer examination, he had developed a low-grade fever and swelling in the inguinal area. A skin infection had spread from a small, untreated fungal rash in the groin, leading to cellulitis. Blood tests confirmed elevated white blood cell counts, and he was admitted for IV antibiotics. Thomas later admitted that he was unaware of any infection because he had long lost the ability to sense temperature or pain properly in his lower limbs due to diabetic neuropathy. These stories highlight the importance of not just hygiene but awareness. Groin issues in older adults are often underestimated because they begin silently and progress invisibly. But the consequences go beyond physical discomfort. Poor hygiene in this intimate area can erode self-esteem, induce anxiety, and decrease social participation. Elderly patients frequently feel shame about persistent odors, itching, or discomfort, fearing judgment from caregivers or family. This can lead to isolation, depression, and in some cases, cognitive decline accelerated by inactivity and disconnection. It's crucial to understand that these feelings are not irrational. Hygiene is deeply tied to dignity and identity. When seniors feel unclean or incapable of managing personal care, they may internalize a sense of failure or helplessness. As physicians and caregivers, we must acknowledge and validate these emotional experiences just as we do the physical symptoms. Addressing these concerns begins with a structured and compassionate hygiene routine. Here is a clinical guide I often share with my patients and their caregivers for maintaining proper groin hygiene in older adults. First, daily washing is non-negotiable. The groin should be cleansed at least once per day using warm water and a fragrance-free, hypoallergenic cleanser. Soap should never be applied directly to the mucous membranes but rather lathered on a washcloth or hands and applied gently to the skin folds. Rinse thoroughly to prevent soap residue, which can irritate already sensitive skin. Drying comes next, and it is critical. Use a clean, soft towel to gently pat the skin dry. Do not rub. Focus especially on areas where skin touches skin, such as the inner thighs and under the scrotum or labia. For individuals with limited mobility, a handheld mirror and a hairdryer on a cool, low setting can aid in drying hard-to-reach areas. Moisture management is where many fail. After ensuring the area is completely dry, apply a barrier cream or ointment. Zinc oxide is a reliable choice. It acts as a moisture barrier and reduces friction. For fungal-prone individuals, antifungal powders like clotrimazole may be used. Avoid talc-based powders as they can clump and retain moisture, contributing to irritation and, in some studies, have been linked to long-term health risks. Choosing the right undergarments is essential. Breathable, cotton underwear is superior to synthetic materials. For those with incontinence, moisture-wicking pads should be changed frequently, ideally every 2 to 4 hours. And nighttime incontinence products should be changed upon waking. After each change, the skin should be wiped gently with fragrance-free wipes or a damp cloth and thoroughly dried. Special attention should be given to clothing choices. Tight-fitting pants or synthetic fabrics can trap heat and restrict airflow. Loose, breathable garments allow the area to ventilate and reduce the risk of chafing and microbial overgrowth. Routine monitoring is equally important. Patients and caregivers should be encouraged to check the area daily for redness, new rashes, discharge, odor, or swelling. Even mild symptoms should not be dismissed, as they often indicate early infection or skin breakdown. Education is vital to overcoming the stigma. Many seniors were raised in times when talking about private parts or bodily functions was taboo. As clinicians, we must normalize these conversations. Empowering seniors to view groin care as an essential part of overall wellness can dismantle shame and encourage proactive habits. One of the most effective ways to shift mindset is by reframing groin hygiene as a form of self-respect. Just as brushing your teeth is routine, so should caring for every part of your body, especially the most vulnerable. It's not indulgence, it's maintenance. There are several myths that need debunking as well. One prevalent misconception is that applying more powder or deodorant will mask odors. In reality, overapplication of these products, especially those with artificial fragrances, can irritate the skin and worsen the problem. Another myth is that if there's no pain or visible wound, there's no need for concern. This is dangerous, especially in individuals with decreased sensation or visual limitations. A third myth is that only overweight people experience groin issues. While body weight can exacerbate the condition due to deeper folds, even thin individuals can develop fungal infections or intertrigo due to mobility issues. incontinence, or poor hygiene practices. Additionally, some believe that washing with hot water is more hygienic. This is false. Hot water can strip natural oils from the skin and increase dryness, which ironically makes it more susceptible to infection. Warm, not hot, water is always preferred. When groin hygiene is overlooked, the consequences can be dramatic. Beyond physical infections, it can affect gait, cause sleep disturbances, and contribute to urinary or bowel discomfort. These issues can cascade into more serious outcomes like falls, hospitalizations, and loss of independence. On the other hand, when seniors are empowered to care for their groin area confidently and regularly, the benefits extend well beyond comfort. They move more freely, sit without discomfort, sleep without itching, and live with a sense of dignity and tact. Their mental health stabilizes. They are more likely to participate in social activities, engage in physical therapy, and follow through with other aspects of their wellness routine. In my years of practice, I've come to view groin care not merely as hygiene but as one of the most telling reflections of a person's physical, mental, and emotional well-being. The patients who tend to this area with mindfulness often tend to their lives the same way, with respect, attention, and care. As we age, the skin and underlying structures of the abdomen change significantly, particularly around the umbilical region. What was once a shallow dimple in youth may deepen or fold in upon itself, especially with abdominal wall laxity, increased central fat deposits, or previous surgical scars. The belly button, or umbilicus, becomes a warm, recessed, and poorly ventilated pocket, ideal conditions for microbial overgrowth. For most of our lives, the navel gets minimal attention. It's assumed to stay clean during routine showers. But for seniors, particularly those with mobility issues, compromised vision, or altered body shapes, the belly button can become a neglected zone that harbors dirt, bacteria, yeast, and dead skin. This neglect may lead to localized infections and, in certain cases, systemic complications. In medical terms, one of the most common navel-related conditions in older adults is omphalitis, an infection or inflammation of the umbilical area. While commonly associated with newborns, omphalitis in the elderly is far from rare. Aging skin becomes thinner, more fragile, and more prone to irritation. Sebaceous gland activity diminishes, reducing the skin's natural ability to lubricate and protect itself. Add moisture trapped in a poorly cleaned umbilicus, and you have a recipe for infection. I vividly recall Peter, a 79-year-old former school principal who prided himself on his personal hygiene and sharp dressing. He came into the clinic complaining of a persistent itch in his abdominal region. He had attributed it to dry skin, but upon examination, we noticed a moist, erythematous patch deep within his umbilicus. A faint yeasty odor emanated from the site. There was also mild swelling and a slight discharge. Cultures confirmed a Candida albicans infection, a common yeast that thrives in warm, moist environments. Peter was visibly distressed. "I shower daily," he said, almost defensively. And he did, but like many older adults, his showering technique hadn't adapted to his aging body. With some stiffness in his back and reduced hand coordination due to early Parkinson's, Peter had simply stopped reaching into his belly button. He assumed water and soap trickling down were enough. Treatment for Peter included a week-long course of topical antifungal cream, drying routines using a cool-setting hair dryer, and daily navel inspections with a magnifying mirror. What's more impactful, however, was Peter's emotional response. He said, "I feel betrayed by my own body. I thought I was doing everything right." His statement speaks volumes. The navel seems insignificant until it becomes symptomatic. Its neglect isn't out of carelessness but often a mix of physical limitation and underestimation of its importance. Consider another case, Marianne, a 74-year-old woman who had undergone laparoscopic gallbladder surgery in her early 60s. Her surgery was uneventful, and she healed well, but unbeknownst to her, the scar left a slight crease in her umbilicus. Over the years, this created a deeper recess than usual. Marianne enjoyed gardening and outdoor activities but often skipped post-activity hygiene routines due to fatigue. She came to see me after noticing redness and tenderness around her belly button, along with an intermittent foul odor. Initially, she self-treated using over-the-counter antibacterial wipes, but the symptoms persisted. Upon inspection, we discovered not only superficial irritation but also signs of a minor bacterial infection caused by Staphylococcus aureus. The infection was localized but deep enough to cause a small abscess. We drained it in office and initiated topical and oral antibiotics. Marianne recovered well, but her case illustrated a crucial point: previous surgical sites, particularly laparoscopic or piercing-related, can alter the anatomy of the navel, making it more susceptible to debris accumulation and infection. Aging bodies don't only experience visible sagging or wrinkling. Structural changes occur beneath the skin, tissue elasticity reduces, collagen depletes, and the body's ability to mount effective immune responses weakens. The umbilicus, often unseen and untouched, becomes a hidden trap for microbial growth. In assessing belly button hygiene, I often explain the concept of microclimates. These are small regions on the body where conditions are ideal for microbial overgrowth, moisture, heat, darkness, and skin folds. The navel is a textbook example. Bacteria and fungi such as Candida, Staphylococcus, Corynebacterium, and Pseudomonas have all been isolated from infected umbilical regions in seniors. These infections often begin with subtle signs: a mild itch, a barely noticeable odor, perhaps a little dampness, but because they are painless or hidden from view, these signs are frequently ignored. As a result, by the time seniors seek help, the infection may have spread or become difficult to treat. The good news is that prevention is simple and takes only minutes each day. Here's what I teach my patients for proper umbilical hygiene. Begin with daily inspection. A small handheld mirror can be invaluable. Check the area for any signs of redness, swelling, crusting, or discharge. The skin should appear clean and dry. If there is any foul odor, this is a warning sign. Next, gentle cleaning is essential. During your bath or sponge bath, moisten a cotton swab or the corner of a washcloth with warm water and a few drops of mild, fragrance-free soap. Gently swirl it inside the belly button, removing any lint, dead skin, or trapped debris. Do not dig or scrub harshly, especially if your skin is fragile. Rinse the area thoroughly using a damp cloth. After washing, thorough drying is critical. Pat the area dry with a clean towel or tissue. If the navel is deep or difficult to reach, a hairdryer on a cool, low setting held at a safe distance works well. Never leave the belly button damp. For individuals with recurring issues or deeper navels, once daily swabbing with a diluted antiseptic solution may help. However, I advise against using alcohol, hydrogen peroxide, or strong antiseptics regularly unless prescribed, as they can irritate or dry out the skin. Instead, a pH-balanced, gentle antiseptic like chlorhexidine gluconate may be safer under medical guidance. If fungal infections are recurrent, a light dusting of antifungal powder, e.g. miconazole or clotrimazole, once or twice a week can be preventative. Those with deep navels, surgical scars, or piercing tunnels should consider cleaning the area more than once per day during hot weather or after heavy sweating. Now, from a systemic perspective, it's important to note that the skin is the largest organ of the immune system. A clean navel does more than prevent local infection, it indirectly supports your immune system's workload. Infections that begin at the skin level can sometimes trigger systemic inflammation or strain the immune response. For elderly individuals with weakened immunity, such as those on corticosteroids, chemotherapy, or managing autoimmune conditions, even a minor skin infection can lead to complications. This is why we must see hygiene not just as a superficial habit, but as an immunological act of self-care. Moreover, unclean umbilical areas can impact mental health and personal dignity. Seniors who experience persistent odor or itching in the belly button area may feel embarrassed during dressing, intimacy, or when receiving care from a nurse or loved one. The emotional burden is often internalized. Many patients never voice it aloud until symptoms become unbearable. A 2019 survey conducted among assisted living residents found that 62% of seniors avoided reporting skin irritation in intimate or recessed areas, including the belly button, because they felt it was not important enough or too embarrassing. But what begins as minor discomfort can evolve into a major quality of life issue. Hygiene routines, when performed intentionally, can be an act of empowerment. They remind older adults that they still have agency over their bodies. They help maintain routine, dignity, and self-worth. The 5 minutes spent cleaning the belly button may be one of the most preventive minutes in their day. I often tell my patients, it's not just about avoiding infection, it's about honoring your body. Indeed, the belly button symbolizes more than an anatomical scar. It is a lifelong reminder of where we were once connected, our first source of nourishment. In many ways, as we age, the belly button becomes symbolic once again, this time representing the small, quiet things that hold great importance. The things we can no longer take for granted. The places we must revisit with care and intention. The overlooked becomes vital, because it is in these little acts, cleaning a neglected fold of skin, drying thoroughly, applying a touch of cream, that we declare, I still care for myself. It may not be visible to the world, but to the individual, it is everything. And in the belly button, this small, forgotten recess, we rediscover a central truth of aging. That maintaining wellness in later life is not about grand medical interventions. It's about the daily, quiet rituals that keep the body whole and the spirit dignified. So, what have we learned today? That something as small and quiet as your belly button can whisper the loudest warning signs about your health. It's not just a scar from birth. It's a pocket that tells us how much we're paying attention to ourselves. A neglected navel can lead to serious issues, especially as we age, but a cared for one can protect your skin, your immune system, and even your dignity. I hope Peter's story, Marianne's experience, and the daily care routine we explored have helped shine a light on why this forgotten fold deserves more love and attention. And if you take just one thing from this video, let it be this. Aging well isn't about doing more, it's about doing small things with more intention. So tonight, when you go through your bedtime routine, take 1 extra minute, check your navel, clean it gently, dry it with care. You're not just cleaning your skin, you're honoring your body. If this video helped you, please leave a comment below. Tell me, what's one small habit you've decided to change today? And don't forget to like, share, and subscribe to Senior Mental Health. We're here every week with real stories, real science, and real solutions, because your best years are not behind you, they're still within reach. Thank you for spending your time with me today. Until next time, I'm Dr. James, wishing you health, strength, and the quiet confidence that comes from caring for every part of yourself, even the ones you can't always see.